linked with RINCOD since day one. Um, I'm also one of the board members. As I say, your webinar say, moderator ko रूपमा पनि I'm conducting. And today we have got Dr. Sanyukta, who is here, who will be presenting to us. So I just want to give an introduction before he starts. So just give me a few moments. So just to give a little bit of background, Dr. Sanyukta, he is the course facilitator for professional development at MBAHS. As a medical professional and educator, he has recognized a significant gap between recent graduates and the multifaceted demands for their roles. So to address this, Dr. Gurung spreads a course titled Professional Development at MBAHS along with a foundation course aimed at facilitating a smooth transition for students. These courses focus on integrating technical knowledge with soft skills and emotional intelligence. Dr. Gurung is passionate about shedding light on often overlooked yet essential aspects of healthcare education. He firmly believes that health professionals should possess more than just technical expertise. He aims to rectify the educational bias that overemphasizes technical skills while neglecting the equally crucial soft skills and interpersonal requirements. Dr. Gurung encourages the health professional education sector led by example, advocating for and facilitating smoother interactions and treatments to ensure optimal patient care, which encompasses both technical proficiency and emotional intelligence. Um, Dr. Gurung also has an interest in sports and he dedicates his research efforts to promote and practice healthy lifestyle. So that's his introduction, and I'm going to hand over the floor to you. So whenever you're ready.
Thank you so much, Shambhavi, for the wonderful introduction. Well, I'll be talking on the topic of enhancing health professional-patient relationship to prevent violence today. So yes, we'll be talking about this topic. And thank you, Niti, for sharing the slides. Well, a brief introduction about myself. I'm Dr. Sanyukta Gurung, and I am currently working in Madan Bhandari Academy of Health Sciences, and I facilitate courses of physiology, molecular biology, cell biology, and professional development. And I completed my MBBS from People's Friendship University of Moscow, and I graduated my MD from Maharajanj Medical Campus in Tribhuvan University. Okay, enough of my introduction now. Let's begin with the topic. So today we'll be discussing about the current scenario in Nepal, the violence against health professionals, and we'll be exploring how we can develop a positive relationship between a health professional and a patient. So in this, by this manner, maybe we could avoid the current situation, the current ongoing violence against health professionals. Could we go to the next slide? Uh, yes, now let's start with what is violence. Violence is an intentional physical or a threat against a person or a community, which can lead to an injury or harm or maldevelopment or even death. So the injury not necessarily is only physical; it can also be psychological. So let's talk about more facts. And these are some recent news that we've seen. So here are some news from our local tablets in Nepal. A lot of violence against health professionals. Uh, yeah, now talking numbers. According to World Health Organization, uh, we should acknowledge there is violence in workplace. So one of the most vulnerable group are the health workers. As you can see the numbers, 73% of health workers face workplace violence among all professionals.
It's just that Dr. Niti is using the thing. She's using the presentation. Okay, she's the main user. That's why it's an A. We're just going to next slide.
Yeah, so we should, I mean, these numbers are staggering. And again, according to WHO, around 8 to 38% of health workers, they suffer some kind of workplace violence during their career. And this data on the right-hand side is from a meta-analysis by Sahibi et al. In 2022. So this is a data from around 12 studies, which incorporates countries like the United States, Canada, India, Iran,
Share your slides.
well, let me try.
No, but I'll try. It's no, but I'll. Oh,
Oh,
again, she's
wait,
here.
I think, uh, i- is it done?
Yeah, yeah, it's done.
Okay. Yeah, so now talking about Nepal, and this is a study done in a tertiary hospital in Kathmandu by Bhusal et al. In 2023. Even in Nepal, we can see that verbal violence is very prevalent, followed by physical, followed by bullying and sexual harassment. And in the yellow bar, we have the yellow bars, they represent the nurses, and the blue bars, they represent the doctors. So this fact, they suggest that nurses are more vulnerable to these kind of violences. So, talking about the same study, uh, the these are the factors, or like we can see that those with health professionals with less than 5 years of experience faced more physical violence, and those health professionals who worked in more stressful environments like ICU and HDU, they've suffered from physical and verbal violences. And those who had longer durations of work durations, more than 8 hour shifts, they faced more physical violence. And those who were working more for more than 48 hours per week
Dinesh,
were more
Dinesh,
vulnerable to
don't
sexual
turn on your
harassment.
data. Don't turn on your data. Don't
Yeah,
turn.
now let's talk about the risk factors, and try to identify certain factors that may cause these workplace violences. So, yes, uh, from the perspective of patients, they are obviously under intense emotions which may alter their attitude and behavior in the hospital settings. And from the perspective of healthcare workers, the shortage of staffs, inexperience, poor coping mechanism, and lack of training could contribute to these workplace violences. And the system we work in, the environment we work in, the crowded environment, the long waiting hours, the strict designated visiting hours, lack of information to the patients, and the cultural differences amongst the in the working environment may also contribute to these workplace violences. So emphasizing on the shortage of staff, as you can see, this is a data from 2015 from a data conducted by UNDP. So you can see Nepal falls far behind among the South Asian countries, where we have only 2.1 physicians per 10,000 people, whereas the WHO recommendation is 10 physicians per 10,000 people. This shows how short we are in staff. Uh, Further emphasizing, could we go to the next slide? Further emphasizing on the shortage of staff, the ratio of health workers to population is 0.63 to 1,000, whereas the required ratio is around 2.3 to 1,000. And the nurses and midwives, there are the data given. This is a more recent data from 2018. It records zero point 0.5 nurses and midwives per 1,000 population, and whereas the required is 2.5 per 1,000 population, and the doctors available for the population is only 0.17 per 1,000 population, whereas the required is 1 per 1,000 population. Yes, I mean, these this workplace violence does have a devastating effect on the victims. So there are studies that record demoralization, symptoms of depression, and loss of self-esteem. And some studies do report signs of post-traumatic stress disorder, like sleeping disorders, irritability, difficulty in concentrating, reliving the trauma, and also alteration in emotions. Uh, could we go to the next slide? So, yes, these effects will obviously hinder the quality of service that is going to be delivered. There is going to be increase in number of people who do not turn up for work. There are going to be people who is going to give up and leave the field. And we already know there is already a shortage of staff in the hospital, and this can further lead to decrease in uh, the health professionals, which could increase the health care costs, because to replace a health worker is very expensive, and uh, the productivity in the hospital setting is going to be very low. Uh, so could we go to the next slide, please? And this will ultimately I mean, there are unreported cases also. So these unreported cases could be because of the inconvenience. There are so many legal processes we have to go through to report a case. So these inconvenient procedures can lead to unreported cases. Some health workers might fear that they might be labeled incompetent, which may also further lead to lower health professionals. And some victims may are vulnerable and may think uh, they may be a victim to additional harassment. So obviously these will cause unreported cases. Uh, and the World Health Organization and International Labor Organization, they have recommended certain solutions, like transferring patients who with a history of violence or aggression to a more secure hospital setting, and to install barrier protections like metal detectors, zero tolerance policies in the hospital setting, to form teams that can resolve conflicts, a system that timely reports all these cases, and to form a flow chart or a guide to assess emergency situations, and also to conduct programs for employee assistance, and also conduct various trainings. And the not councils and associations, they also play a vital role. So they may contribute by advocating about the current situation, and they may also incorporate clauses against workplace violences, and they can review procedures and enhance the surveillance in the hospital setting, and they can also build up a support system for the victims in the current situation. Yes, non-governmental organizations, they have played a vital role in diseases like tuberculosis, HIV, but it is high time they also act uh, in this current scenario. As uh, we know, as we've talked about this already, this violence is going pandemic. It is not only endemic to Nepal. And so they can help us by building strong networks, promoting awareness of the risk, training and education programs, assisting in support structure, incorporating and emphasizing good communication skill and coping mechanisms. What has our government done? So, in 2010, the government implemented a law that provides us with a provision of a fine between 3 lakh Nepali rupees to 5 lakh Nepali rupees, and a jail term of 2 to 5 years. So, this they can be either or they can be both. But in the recent events, the agreement between the government and the doctors in the current strike. There was we all know that there was a protest a couple of weeks back, conducted by the doctors against the violences against them. So they came to an agreement where the government promised they would implement this law properly. But our media, they covered the hot topics like the violence, and uh, they covered the protest, but the follow-up news, I did not find any follow-up news when I was searching in the internet. So now, okay, let's move on to this topic. How can we improve health professionals patient relationship? Yes, the numbers are staggering and it is depressing, but we from our each of us, we not only in as health professionals but as civilians of the country, we can play a vital role. We can we'll talk about in the next slides. So, okay, now I very much like this picture. So, what is professionalism? Yes, it does. A very important component of professionalism is knowing what to do, what your work is, but how you do it is also a very important component. So, as you can see in the picture, yes, the professional does know how to draw a line, but this hidden components, the which are not taught to us, the selflessness, the service for others, should also be taken, should be also be given importance. uh, so the American Medical Board, they define professionalism in these 3 points: commitment to well-being of patients, two, accountability to quality excellence. So yeah, health professionals, they go through a lot of exams, they are evaluated for their quality, and responsive to the health requirements of the community. Yes, we did see that in the pandemic 2000, in the COVID-19. A lot of health workers, they slept in the hospitals, they worked very hard. In the earthquake, they stayed in the hospital for non-stop hours, for long hours. But the component of uh, commitment to well-being of patients, selflessly working for the well-being of patient, is also a very important component which should be given very much consideration. So what we should understand is in a clinic there are two experts. There is one is the health professional with a set of skills and knowledges the health professional has, the medical expert, and the other is the patient who has experienced his or her life. The experts, they're experts in their own needs, concerns, and experiences. So we should understand there are two sides, two perspectives, two realities, and uh, as a health professional, as a uh, health professional, it is very important to have a multiple perspective, to understand, to look from every side, from multiple sides, and for a better outcome. So one way I teach this to my students a lot, a very proper way to attain a patient-centric goal. It can be attained by a mutual understanding. So what is mutual understanding? How can it be developed? By respecting the person, no matter what the ethnicity, what the sexuality, what the person's habit is, maybe a drug addict, or maybe an alcohol who consumes a lot of alcohol, or maybe a smoker. We should respect them no matter of all means, and establishing a trust, being empathetic, uh, looking at different perspective from their shoes can help us build up a mutual understanding, which can further lead to a therapeutic relationship. So this is more about a rapport built up and a therapeutic relationship. So a collaborative relationship. So doctors and or health professionals and patients, they are a team. They're not working against each other, but they're together working against the disease. So this may help us attain a patient-centric goal. So yeah, it is very important to use all our sense organs when we're dealing with our patients, not only in the medical field, but even as teachers or bankers. We have to learn and see patients, or like a person in the other setting. We have to listen to them. We listen to the patient, feel their vulnerability. They're in a new environment. We should feel their anxiety, their fear, and their psychological aspects should not be ignored. And a growth mindset is very important. So growth mindset, which incorporates no fear of failure, accepting challenges for a better outcome. So how can we attain this? We can maybe attain this by being more empathetic, by seeing the situation from different people's shoes, and by practicing it regularly. So these tools, if incorporated in our medical curriculum or maybe in our school curriculums, could maybe help us build a more empathetic population. So what is we can use tools like acting. So this I found this tool very interesting. So what is empathy first of all? For empathy is putting yourself in somebody's shoes, somebody else's shoes, and understanding their emotions and reasons, whether you agree or disagree with them. So we can use this tool, either from a health professional's perspective. Can maybe we can act or like practice or see the other side from the patient's perspective. So this should be incorporated from the younger ages in our curriculum. That's my perspective. Because have you a situation like uh, when we're going to a government office in Nepal, right? Let's have the situation. This situation is going to be very new for me, but this might be a uh, routine duty for the person behind the desk. But if the person could see me not like a number, but maybe a person. Maybe we could have a very positive working environment, and the anxiety to go to a government office for a passport or maybe for a citizenship or voter's ID would be easier. So this is not only in the health professional setting; it can also be in different settings. Could we go to the next slide?
Next.
Uh, yeah. So, okay, health professionals. Like I said it already. Uh, First, when we're new, the cases, the patients, they may be new to us, but when the health professionals, they tend to see it very regularly, they tend to get desensitized, and this may become a routine for them. But we should understand this sickness or disease might be new for the patient, and we should treat every patient uniquely. We should not treat them as numbers. We should not treat them as diseases. We should not treat them as cases, but we should treat them as a unique person. Next slide, please. Okay, now talking about cognitive bias, I like this picture. Uh, okay, when I worked as a doctor in my training days, or in my okay, when I was working as a doctor, so a lot of my friends were called sisters or nurses. So a, a perspective in a Nepali society of a doctor, if you ask the society what a doctor looks like, or to draw what a doctor looks like, the person in the society most probably will assume a doctor is a male. So we should address our biases. These are our biases, the society, which depends on the society we grew in, the learnings we got in our environment. So, looking at this picture, when we read it vertically, I'd read the number in the center as 13 or 12, 13, 14, right? But when I read it horizontally, I read it ABC. So it is very important to look from different angles and different perspectives to get a very healthy working environment. Next slide, please. So yes, using our sense organs. Each case is unique, and we should address our cognitive biases, thinking biases, perspectives. You know, in this illusion, the red spots, if we just glance at it, it would say we would say that the red on the right is bigger, but actually the red dots are of the equal size. So it is very important to use all our sense organs to look at these, look at every situation. So next slide, please. Yes, and auditory illusions too. These two verses, I incorporated this from a book written by Catherine Coe. Um, it is the left verse and the right verse, they're exactly the same poem written by her daughter, 1-year-old daughter. But the spacing between the words, spacing between the letters, they try to give us a different perspective. So it is very important to try and use all our senses. So we all have cognitive biases. We all have, biases, unconscious biases that the environment we grew up in. Uh, so we have to address these biases. So one way is like by treating each cases uniquely. Like I mentioned earlier, all cases are unique. They're not numbers. They're not diseases. They're not cases, but they're person. Uh, Treating patients impartially, no matter what their gender is, no matter what their age is, no matter what their race is, ethnicity is, no matter what their habit is, what their occupation is. We should treat them impartially, and we should try and see the patient as a person first. Uh, One way to do that is it is like I mentioned earlier, it is very important to establish a mutual understanding. So white coats play a very important role in this. So to build up a health professional and a patient relationship, it is very important to communicate before the patient
dresses up in the patient's gown, so we can see the perspective from a different angle. And it is also very important to explore our unconscious biases, the biases that we already have, but we do not know about. Okay, here is exercise which we could practice. It is exercise called Harvard Implicit Bias Test. So you here we can test our skills of diagnosis by when we feel a certain feeling, or I mean when you see somebody's facial expression, we try and interpret. You should try and interpret the emotion, and then you should try and ask the patient or the person if you are correct. Or this can also be done the other way around. You can test others' skill. When you feel a certain emotion, you can ask the other person, "What do you think I am feeling like?" and check whether they're right or wrong. You can also try this over the phone by using your tone of your voice. When you're feeling a certain emotion, you can maybe ask the person and test their skills. So, okay, finally to the final slide. Roles as educators. We all do have roles. So, uh, in our institution, we teach professional development. Here, we teach it in the first year, and we have these unseen curriculum set, uh, unseen skills, the soft skills incorporated in these courses, like attitude, ethics, and communication skills. So these skills are supposed to be taught to us by our seniors. They're called the hidden curriculum. We're supposed to see it and learn it, observe it and learn it. But the data in the recent days, as we've already seen earlier, the violence is increasing. So it is high time we incorporate, we teach, we try and educate these certain topics in our curriculum. Yes, obviously, when we teach medical students that smoking is wrong, they some portion of the students they are going to choose and smoke. But if but maybe a certain population might choose not to smoke if we explain it why is it bad and how what are the consequences if you smoke. So yes, we conducted a study among our students. Here we measured the empathy scores. So we used the Jefferson empathy scale, which has three components: the component of perspective taking, component of compassionate care, and walking in patients' shoes. And after we measured it, we found that the third semester students, we are a very new institute, so we currently have only 4 semesters. So this study was conducted a couple of months back when we had only 3 semesters. And here we found that the third semesters had relatively higher empathy mean scores. So these students were taught, given the courses of professional development. And maybe the professional development helped us to increase the empathetic scores among the third semester students. Though the scores were not statistically significant, uh, it did show an increase in the empathetic scores among the third semester students. And yes, we did have limitations in our study. It was done in a single center, and among limited students. But if this study is conducted in multiple institutions, and maybe if we improve the methodology, maybe we could get a better understanding. But I think from my perspective, it is very important to incorporate uh, professional development, which incorporates topics like uh, attitude, ethics, communication skills, empathy, humanity, in among medical students, and also in our younger students in the school level. Maybe we can have a more empathetic population. Yeah, so that is most of the topic. If you are interested to uh, read more, here's my bibliography. We there These are some articles, and in the next slide also we have certain more articles, and I would suggest you to go through this book, how to build up a patient doctor relationship by Catherine Coe. It is a very interesting book, and yes, let's be kind to each other, and thank you.
Thank you so much, Dr.